The federal government has clarified the reasons it has been unable to meet certain demands that have prompted threats of industrial action by the National Association of Resident Doctors, NARD. This position was outlined on Tuesday by the Minister of State for Health and Social Welfare, Dr. Iziaq Salako, in a statement issued by the ministry's Director of Information and Public Relations, Mr. Alaba Balogun. Salako said the government has shown commitment to improving the welfare of health workers through recent reforms, including the upward review of professional allowances estimated at about 90 billion nairas annually. He noted that the revised allowances covering call duty, shift duty, non-clinical duty and rural posting were approved in November 2025 and negotiated collectively with all health professional groups. According to the minister, previous negotiations were often conducted separately with different professional groups, resulting in conflicting agreements on pay parity and relativity, which frequently led to industrial actions. He said the current administration has adopted a collective bargaining framework to promote inclusiveness and minimize disputes. Salako explained that although the government is committed to better remuneration for healthcare workers, such reviews must be balanced with other national priorities, including education, security and infrastructure. On NARD's current demands, he disclosed that the association's list had been reduced from 19 to 9 items, describing this as a positive development in ongoing discussions. However, he noted that some demands are constrained by existing public service rules and approved schemes of service. Addressing the call for specialist allowance for resident doctors, Salako said residents are specialists in training, and that the allowance is currently designated for consultants in line with established regulations. He added that the National Salaries, Incomes and Wages Commission had cautioned that extending the allowance could prompt similar demands from other categories of workers undergoing specialist training. On concerns over delays in certification, the minister clarified that the National Postgraduate Medical College does not issue certificates after Part 1 examinations, and that the ministry has no authority to override the institution's policy. Regarding the disengagement of 5 resident doctors in Lokoja, Salako said the action followed civil service disciplinary procedures. He disclosed that a ministerial review panel has recommended the reinstatement of 2 doctors, reprimand for 2 others, and a fresh hearing for 1. The minister assured Nigerians that the Ministry of Health, working with the Ministry of Labor and other stakeholders, remains committed to continuous dialogue to stabilize the health sector and prevent disruptions to healthcare services. NARD represents resident doctors undergoing postgraduate training in teaching hospitals nationwide and frequently embarks on industrial action to demand improved working conditions, timely payment of allowances and pay parity with other health professionals.